Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and our supplement range, Genesis, which is designed for people diagnosed with chronic kidney disease to decrease creatinine and improve eGFR levels. And I'm joined again by one of my favorite guests today, the amazing, the wonderful, the fabulous, the Bette Midler sing-along like Lindsey Zirker. I've just been telling her she has to do a rendition of Wind Beneath Our Wings halfway. I'm not sure she's going to come through with the goods. Lindsey is a renal dietitian, published author, and all things fabulous when it comes to renal disease. She worked in the dialysis unit for a long time, so is very well versed in that, and has now joined the team at Kidney Nutrition Institute as one of their head lead renal dietitians. Lindsey has I was going to say a special interest in hormones and minerals, but the hormones, I feel like, Lindsey, you were just like, you are now the expert on hormones and you weren't given much of a choice in that.
I feel like I'm learning a lot still. Yeah.
Yeah, oh my goodness. But she definitely is an expert on minerals. So we've been doing a mineral series. So we've done zinc and selenium and phosphorus, iron, and a few others. And today we're going to talk about probably a lesser known mineral in general. It's not one that I supplement a lot, that not to say that I never have, but that is copper. So Lindsey, I'm going to hand all things copper across to you. So let's start high level. Copper mineral, because most people would know it as more a metal and things like that. So tell us copper and the role it plays in the body, and then we'll dive into how that may be important in kidney disease.
Yeah. So copper, it is a mineral that is found in lots of foods, and it is used a lot in our body as a cofactor for lots of different enzymes. And so that's why before we hopped on here, I was joking with you, Fiona, about copper is kind of like the wind beneath your wings kind of situation where it doesn't have you know, a lot of spotlight on it, like iron or zinc or phosphorus, but it's still really important and performs a lot of really important tasks. So some of the cofactors or some of the cofactor roles it plays is in iron metabolism. In order for iron to be transported around, copper is a part of that. And also copper is required for T3 or T4 synthesis, which are your thyroid hormones.
Mm.
It also is a cofactor for the production of some neurotransmitters like norepinephrine, and also for antioxidants like superoxide dismutase, which we don't talk tons about, but it is a big deal. Um, and then it also plays really important roles with gene expression, immune function, and other lots of different things. So it's the wind beneath our wings.
Oh, I so wish you were going to sing a rendition, but I won't make you.
I don't know. I'm just not feeling it today. I should have practiced before we got on.
I don't feel it any day, so that's all good. So when we say it like that with copper, copper sounds actually super, super important. Is
Yeah.
a copper deficiency? You said it's in a lot of food. So, I mean, I don't see it come up often. I have seen copper toxicity. You'll see if anyone does iridology, people get these blue rings around the outside of their iris. That can mean a few different things, but you can get this
Yeah.
blue-like marking in the sclera of the eye. But is it one that you see a deficiency in a lot in clinical practice?
It is not. I mean, as is the case with most vitamins and minerals in kidney disease, we don't really know how much people need. I mean, we have the DRI, the RDA, all those kind of guidelines, but as we know, they're not really designed for people with kidney disease. And so thinking about how copper is an enzyme cofactor for a lot of things that maybe could be upregulated in kidney disease. So maybe people have higher needs. But that being said, when I've had the chance to do more in-depth functional nutrient testing, as well as looking at patients' food logs who've been pretty diligent about logging things, copper is not something that really seems to be a problem. And I mean, in my case at least, I mean, Americans love their potatoes, and copper is in potatoes. So I feel like that's single-handedly saving people's lives. Um, as long as they haven't cut potatoes out because of potassium. So, um, yeah, it isn't one that I've seen, but because we don't really know where the lines are, people could have potentially copper insufficiency, and the symptoms of low copper levels, they could be attributed to a lot of other things potentially as well. So it is kind of tricky, but I feel like most of the time, if people are eating pretty okay, their copper intake is probably pretty okay.
Interesting. And when you do like those big organic acid tests, and even the like it's the Nutristat here in Australia, and it's the one of the Geneva tests that you do that do everything. And one of the markers that comes up a lot for me is the zinc to copper ratio, which
Mm.
obviously I always see copper is higher than zinc, and that will generally be an indication to me that there's oxidative stress in the body. That's one of the things that we use the zinc to copper ratios to determine is oxidation, because people would know that if you oxidize copper, like the old copper pipes, you get this
Yeah.
blue ring around your sinks and things like that. And that's the oxidization process. So if you have a higher zinc to copper ratio, the theory is that you're more likely to get oxidation going inside the cells with the minerals that make it up, and you get this oxidation effect. And I see that, I would say I see that in 95% of my patients. If we are just looking at a zinc to copper ratio, I'll always see the copper higher. So then I'm always working on zinc uptake, which usually comes down to generally how much hydrochloric acid and stuff you've got going on your gut. That's one of the things that zinc is
Yes.
linked to. Is that something that you see a lot on the patients that you're doing with kidney disease?
It is. I'm always like, people's zinc is low. And I think a big part of the zinc being low, in addition to like stomach acid issues, is that people can start wasting your zinc in their urine at really early stages when they don't even maybe know they even have a kidney issue. And then shifting to lower protein plant-based diets, if you're not really paying attention to things, it can be very difficult to get enough zinc. Or if people have gut issues, they have a higher need for zinc because they got to repair all that gut lining and stuff. So typically that's what I am seeing. But I don't know. I think a part of that too is people, we always hear about that zinc copper ratio. And like, you shouldn't be giving people, zinc supplements because it's going to block the absorption of copper, which that's a true biochemical thing. But when I was like digging into like what zinc copper ratio should we be looking at, I was seeing anywhere from 8 to 15.
Yeah, same.
And so I'm like, well, what is it? Because that's like double. So
Exactly.
I think it's just one of those kind of nutrition things that someone found out about, and they're like, this is really important. And then no one's really like dug into it anymore. It's just something that keeps being repeated and repeated and repeated. Like, don't take a zinc supplement because it could cause copper deficiency. And it's just like, well, is no one caring about zinc deficiency now? Or like, and
Yeah.
copper is important for iron metabolism, but iron can also block copper absorption. And no one's ever talking about don't give iron supplements because of copper deficiency. So I don't know. That's why it makes me feel like it's just some of those like nutrition things that just kind of keep getting repeated and passed down, and oral nutrition traditions that maybe we need a little more thought to go into those and say, yes, if we're going to give any kind of supplementation, we want to do it responsibly. So yeah, we should pay attention what's going on with their copper. But when you've got a range of 8 to 15 zinc to 1 copper, you've got some wiggle room.
Yeah, exactly. No, I totally agree. That's exactly what I see in practice as well. I think you're right. A lot of these oral nutritional things, potassium being one of the big ones that we all talk. So I'm bringing up every podcast that I can. But yeah,
Yeah.
so tell me, what would be the signs and symptoms that people would be looking out for with a copper deficiency?
So there's quite a wide variety of deficiency symptoms. I'm double checking my notes here, make sure I get some of the ones. So one of the interesting ones that I think is, I don't know, interesting to note with kidney disease is people will have really fragile hair
Mm.
with copper deficiency. And there's so many like hair issues in kidney disease. And so, of course, again, biotin is that oral tradition that's been handed down. But really, there's so many different reasons why you could have problems with your hair, like falling out, breaking, being fragile, all those kind of things. So, copper deficiency is one of those. Um, but there's actually a decent amount of neurologic issues. So some people having like an unsteady gait um, with it is kind of one of the more hallmark neurological issues that we might see. Um, but you can have edema, cardiovascular disease, poor immunity, high cholesterol, or weird lipid metabolism, osteoporosis. Do any of these sound like kidney disease symptoms that we think that's just because they have kidney disease? Like, it's probably not the whole reason why, but maybe for some people it's a factor as to
Mm.
why those things are showing up. Another one that's been on my mind a lot is you can have anemia. People can be unresponsive to iron or EPO ESAs because I'm doing my anemia deep dive right now. And so, yeah, copper deficiency is definitely puts people at risk for anemia because you can't transport iron around anywhere, even if you have enough. If you have no copper, iron's not moving anywhere.
Yeah, that is such a good point. And the name goes out of my mind. There is a protocol where they actually say in anemia that copper is more important, and they really put an emphasis on
Oh yeah.
bumping copper levels. I can't remember the name of the protocol. It's quite a well-known one that some people have studied. I've spoken to the author of it, and for the life of me, I'm so sorry, Stephen, someone, I forget your name. So, and I know Dr. Rick Cohen, who I've had on the podcast before, we did speak in detail about copper being potentially an unrecognized mechanism in iron non-responsive iron deficiency. So that makes sense.
Mhm. Mhm.
Okay, and what about toxicity? Is that ever something that you see in clinic where you have a copper toxicity?
I personally have not seen that specifically. Um, but again, a lot of the symptoms can be really generic. I mean, there's the one specific one with the eye that you mentioned, but I feel like some of the symptoms that you're like, whoa, it's like, well, yeah, you really have top copper toxicity, not like you're kind of in the danger zone. So the most like common things is like nausea, vomiting, and diarrhea. So it's like, oh, okay, let's dig through lots of possible, you know, reasons why. A copper toxicity, though, it can cause kidney damage. So that is one of the symptoms. And then anemia is the other kind of big one. So if you're looking specifically just signs and symptoms, those are the most common ones.
And Wilson's disease.
Oh,
That
yeah,
is,
Wilson's disease. That's the other one. Yeah.
yeah. So interesting. I had an MS patient, and when we did all her bloods and I tested copper through the roof, and when we went back, Wilson's disease, and all her neurological symptoms, and she had quite massive personality changes, which they were putting down to being copper. And I was like, sorry, not copper, being put down to the MS. And I was like, I think this is Wilson's. Interestingly, again, vegetarian for a very long time, high plant-based diet, old house, old copper pipes, which might not be as big an issue in the US. They
Mhm.
changed the in Australia. I think they had to get rid of all the old copper piping, but I think they had an old house with copper piping in it, and then we didn't have any real zinc
Yeah.
or iron blocking absorption. So I actually have seen Wilson's disease 2 or 3 times now on testing. And it for
Wild.
them, yeah, wild. And it manifests generally what I've seen, yes, the nausea, but lots of neurological symptoms. So
Yeah, kind of interesting on either end, like whether you're deficient or toxic, neurological situation going on, which makes me
yeah,
wonder too with like that situation, like what was going on with B12 because you see lots of neurological issues with B12 as well. So,
100%, especially in
yeah.
MS. B12 is
Yeah.
the process chain for remyelination.
Yeah,
So
the
yeah,
myelin sheath and all that.
yeah. So yeah, very interesting. So I have seen that, but Wilson's disease, there's a genetic component to that that means that you uptake more copper, right? So that you've got to
Yes.
have a predisposition, hence why I've seen it, because there's been a genetic predisposition in there versus that's the only time I've seen copper toxicity versus a straight copper toxicity for copper's sake versus a genetic Wilson's disease. Yeah.
Yeah. Yeah.
All right. What else? So foods. What food? So you mentioned potatoes. What else do we have? If people are like, I'd like to actually bump up my copper levels, or I have Wilson's disease. What foods do I need to completely
Put
cut
to
out?
avoid. Yeah, so like the top like highest copper sources are oysters.
Yeah,
Uh
really.
I
I didn't
know.
know.
Zinc and copper, that's if you need both of those, you want to go with oysters, which is interesting, right? Because of their absorption thing, but
Yeah.
nature is smart, so we just haven't figured out why it decided to put those together. Um, but outside of those two, millet and mushrooms. Um, those are kind of the really big ones. And I feel like mushrooms is definitely going to depend on where they were grown. I mean, as with any kind of food, especially like what minerals were available in the soil, you know, good and bad, that's what's going to be in um yeah, in the food, but also other foods like cashews, walnuts, pistachios. They have decent amounts of of copper. Oh, and pecans. Um,
Oh, okay.
lots of nuts and seeds have it. I mean, you're gonna have a little less bioavailability there, but and then like other animal proteins, they're gonna have some copper in there as well.
Yeah. And interesting, talk about oral traditions, right? You remember the thing that went around maybe 10 years or 15 years ago when mushrooms were a really high source of B12, and they're like, all the vegetarians should eat mushrooms because
Oh.
nice and high in B12. And it was, you probably know this for people listening, it wasn't the mushrooms. It was because most mushrooms are grown in dung, be it cow or horse or something like that. And when they actually washed off the mushrooms to check, mushrooms don't have much B12 in it, but their poo does. And it was the poo that had all the B12 in it. So I'm like, again, these oral traditions that get passed down. I still have vegetarians saying, "Oh no, we don't worry about B12 because we eat heaps of mushrooms." And I'm like, "This is why this is why people thought that mushrooms were high in B12. It was the poo that it was grown in."
Oh, man. Yeah, and that's why like it can be so tricky, right? Because if you're not, even if when you're like in nutrition, you're like, wait, is that just like something that's people have been passed down forever? Has anyone ever asked any other questions around this? It's really tricky and frustrating.
It really, really is the same with vitamin C causing kidney stones. We know that that's not true. It's one study that was really poorly designed. It may be slightly elevating men, but it's slight, and it's been this thing that's been handed down. It's like there are no studies that prove that. A bit like our potassium story. It's like, where did that come down? And then it just gets. And even if you look on WebMD and all those places, they pick it up. But when you go and dig into the studies and the quality of it, which is something Lindsey and I are well trained to do, you're like, there are no quality design studies that actually legitimately back that up. It's just one study that got blown out, and then it became the study for everybody else referencing back to. It's so fascinating how this happens. So
Well, and sometimes I think that can happen because maybe like if people are trying to find like for kidney stones, if they're like, that sucks, like how can we prevent that from happening ever again? And
yeah,
they find one thing and then they're like, okay. But and so I feel like that can happen a lot of times when it's just like we want some kind of answer, even if there isn't awesome evidence for it, which is okay. But with that, like especially like here in the US, there is a specific type of testing that is covered by insurance that it makes it stupid easy to see exactly what's going on that is increasing your risk for kidney stones.
yeah.
And they don't look at vitamin C at all.
No, exactly. Same in Australia. So I know. Again, the logical, practical stuff sometimes just, for whatever reason, gets put to the wayside. So that's why I love
I
you,
don't know,
Lindsay.
it's weird.
Logical, practical, like I do. So, so I mean, copper. There's not a lot more to say about it. Anything else that we haven't covered? Is there any medications that might deplete it? any medications that are actually higher copper that might actually increase risk of toxicity that patients might need to look out for?
I didn't come across a lot of those, but I feel like with almost, well, let's be honest, with any nutrient, you have an increased risk of deficiency if you're on any stomach acid lowering medication. I mean, we really talk a lot about it with minerals, but like if you don't digest your food well, like you're not really going to absorb it. And then the gut bacteria is going to get it, and then your gut bacteria is going to bloat up and you're going to have lots of extra.
Yeah.
So yeah, that's like the big one that I think. But I don't know. I didn't really come across any that was like super like, oh yeah, if you take this medication, risk for copper deficiency or toxicity. So um yeah, I'm not thinking of any with that.
No, and I didn't see any either. I just saw the same ones that you did with the stomach acid, especially things like Mylanta and all those guys. And they're high in aluminium, right? So you get that complete imbalance. So you get more of the heavy
Mm,
metals.
yeah, yeah.
So, Lindsey, what else? Is there anything else that we need to say about our friend copper before we have to wrap up this episode without you singing Bette Midler for me? But that's okay. Forgive me.
So testing for copper, right?
Oh, yes. Thank you.
So as we always love to say, looking in the serum is not always the most helpful, because of different forms and where it's stored at. So, I mean, you can look at that, but how much is it going to tell you? So you have the option for red blood cell copper, which is going to tell you, one, if it's actually getting into the cell, and then what is it, like a 4 to 6 month, uh it's going to tell you what your copper intake, if it's been enough within the past 4 to 6 months or something like that. um but other things that you can look at where like copper is needed as a cofactor, and if these things are low, then that would be an indication that maybe you're not absorbing it enough, or it's not getting to where it needs to go. So that would be things like superoxide dismutase activity, or I can never say these right, homovanillic acid or vanilla mandelic acid. Did I say those right?
Sure,
So you
yeah.
can look at that urinary ratio, and if it's greater than 4, that might indicate that copper is, not either not adequate in the diet or not getting absorbed or whatever. It's not ever to be able to be functional. And then you have the serum ceruloplasmin, if that
Mm.
level's low, and um, that's the transport for iron.
Yes,
So,
and generally, if people are doing these big Nutri-Eval tests or Nutristat here in Australia, they will give you copper to zinc ratio and the
mhm.
serial ratio, and that's how they work out how much free copper is sitting inside the system. Interestingly, with cryptopyrroles, I don't know if you were, that was such a big thing years ago when people had elevated pyrroles. And it often would cause a lot of anxiety and gut issues. I used to see a lot of patients with it, and it now feeds into the MTHFR genetic sort of stuff. But if you treated people with, I think it was B6 and zinc, because generally people would have a low seroplasma level, so copper transporter. No, but it'd be high, but they'd have high um, high copper low zinc ratios, so that high elevated copper in the blood, and you would basically give them zinc and B6 in the active form, P5P, and that would often fix a lot of those issues. So the pyrrole, it was really big again 15, 20 years ago. Pyrroles, everyone was treating it, and then everybody got sidetracked by MTHFR gene mutations and things like that. But every now and then you get someone in, I'm like, oh, this seems to be like actually quite a pyrrole issue. You can test for pyrroles and they'll give you the same metrics.
Okay.
So
Oh, about
um,
that one.
yeah, again, it was super popular. Things go in and out of fashion, right? So yeah, it was super popular before the
That's good.
MTA gene mutation stuff came in, and then people got sidetracked with that. But sometimes just giving straight zinc and some P5P would fix. I remember having a patient, insomnia, ADHD, severe anxiety, and we in the time when I was running pyrrole tests, and we fixed that, and all his symptoms went away. It was amazing. Minerals cannot be really underestimated about how impactful they are. So it's not like I did anything else. It was P5P and zinc in a picolinate form. It wasn't even like it was in the big carnosine form or anything like that. And his symptoms just went poof, but disappeared.
And it's so interesting. I like in digging into vitamins and minerals and stuff, I feel like it is so hard to find. Like if you're like, oh, I think this person has a deficiency in X nutrient, that would be the only nutrient they have.
Yes. Yeah,
And
it's normally not
yeah,
like that.
they're always like girls going into a bathroom. They always are in packs in some form or another. You're never gonna find them by themselves. And I think that that is why like looking at the root cause is so important. Why do we think this person's copper is high or why do we think it's low? Because then like if you don't treat whatever root issue it is, like that's going to be a problem. Or if you miss out on the other key nutrients like with anemia. If you're like, "Oh, this person's having all these problems, let's give them a bunch of iron." Well, what if the issue is copper or vitamin A or vitamin C or all of them because they don't have a working gut? Like, so,
Such a good point. And and this is where, it's been the naturopathic saying for as long as I've been a naturopath, which is coming on 30 years, is the gut is the cause of all disease starts in the gut. And then when we have these conversations, you go back, you're like, wow, I really can see how we can continually trace back so many issues back to the gut and the microbiome for mineral absorption and all those sort of things. And I also think mental health and the way you see life and
yeah.
stress and all things is equally in par. But I think often with patients, I'm like just working on getting the gut right, even kidney patients, getting the gut right, getting stress levels right. And a lot of the time, the body then suddenly will pick up the minerals exactly like you said, like they're used to without having to do a whole pile of mineral supplementation. Because the body is so intelligent. If it's not absorbing minerals properly, and you're eating a pretty good, that is with a caveat that you're eating a good balanced diet and
Yeah. Yeah.
it's full of inflammatory foods and seed oils and all that kind of stuff. If you're doing all of that and there's still stuff going on, then yeah, coming back to the cause. And it's why I say pretty much every podcast is if you have a chronic disease, especially kidney disease, working with someone like yourself that specializes in the area and that can walk you through that and isn't treating you like you've got kidney disease, because let's face it, the rhetoric around that is you're a pair of kidneys that you might need a transplant or dialysis, versus kidneys are an integral part of this
Yes.
big holistic mechanism and system. And let's go and look at your gut and let's go and look at inflammation and oxidative stress and inflammaging and your mitochondria and all of those things and your blood sugar level and all those things. And we get that right, your kidneys may, without particularly doing anything that looks specific to kidneys, may just fall back into working order, which happens more often than not, surprisingly.
Yeah. It's usually like a symptom of another issue. Like it's
Yeah.
showing up as kidney disease, but really the problem is other things.
And I feel like kidneys are very subjective to that, because cardiovascular disease and diabetes being the leading causes of kidney disease, and because they're such a big filtering unit, the last sort of filtering unit that things go through before they leave the body, and the role in just the massive role that kidneys play in homeostasis,
Yeah.
that like the massive, they're probably one of the biggest organs. I don't know what you think about that when it comes to homeostatic mechanisms. And homeostasis is your body's survival technique. Like it will ditch everything else in an attempt to stay in homeostasis. So the kidneys get thrown out really easy with that. And I think they're overlooked as how important they are. But yeah, 9 times out of 10, kidney disease is caused by something else. And when you go back and fix that, kidneys, at least you set up the environment for them to heal. So
Exactly. Totally agree. 100%.
anything else you want to say about copper before we wrap this thing up?
I don't think so. I think just, being aware of it and kind of like going back to like choosing a well-rounded diet. And if you're not sure, like it's really helpful to go into a food tracking, thing and just put in what you're eating and see what's going on there. And then when you have questions about it, you can take that information to someone trained in nutrition to help you iron things out and be strategic about it. So
Yeah, I totally agree. And if that's something you want to do, you can find Lindsey at kidneynutritionalinstitute.org. She works with people actually all around the world, but because of the wonders of telehealth. But if you're in the US, you can do it through insurance if you've got that sort of stuff as well. So have a look at that. They run some great programs. Have a look for Lindsey's fabulous chapter on hormones coming out in Spring and Nature Text, whenever that's going to come out. We will actually let everybody know when that bad boy's out, because so many people I podcast with, including myself, we're all authors in there. So we'll be doing a big look. We're actually cleverer than we think. Actually, apparently we do know what we're talking about, which is amazing. It's nice when that gets, you just know Lindsey is like, oh,
Yes.
I actually have something to contribute to this narrative, which is great. So it's not talking to screens in on a podcast, so it's awesome. So
yes, yes.
So if you want to know more about Lindsey, you can head to kidneynutritionalinstitute.org. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on all social platforms as well, on Instagram and Facebook under the same names. Lindsey, it's always a pleasure. Do you know what mineral you want to? I think maybe we're going to tackle calcium next, aren't we?
Yeah, I think we should address calcium. Yeah.
It's a bad boy. All right. We will be back next time to discuss all things calcium. If you have any questions that you want for that podcast, chuck them below. Thank you for being part of our community. And Lindsey, as always, thanks again. We'll see you all next time. Bye.
Thanks.